So, doctor, today I would love to hear more about diabetes, which is, as you mentioned, one of the main cause of teeth problem.
Yeah.
So, if you can say about the issue, how it started, how to solve it, and how here in Turkey we can solve it.
Of course. Basically, there are two types of diabetes. One is hereditary from the birth. Second is develops like after 40 years old, 50 years old, depending on your stress level and your consuming of food with, unfortunately, glucose, basically sugar.
Processed foods.
Yeah,
I
unfortunately,
think more.
yes.
Yeah, processed.
About your
Yeah.
feeding habits, let's say. So the type 1 is something that you cannot prevent. Obviously, you get it from your parents. And the only way that you can avoid is using, unfortunately, insulin. Probably your pancreas cannot able to produce enough insulin, so basically you have to take insulin from outside sources. And we will talk about the dental affectation on that. But first of all, let me remind our patients the symptoms, because usually people tend to think that I am okay. I am okay means, as the Hippocrates says, if you say you are okay, you are okay. But if you feel some symptoms, that means you have something going on. You have a headache, but if you do not mind, there's definitely something going on.
Yeah.
You might need to fix it. The three symptoms of diabetes is severe feeling tired. You feel tired all the time. You feel dry mouth. Whatever you drink, it is not enough. Your mouth is always dry. And you feel like sleepy after you eat. These three symptoms are the first symptoms of diabetes, and I usually ask the patient if you feel like a dry mouth, if you feel like tired too many times, and if you feel like sleepy after you eat. These are the main symptoms.
Yeah.
If they have such concerns and symptoms, they definitely need to get them checked up. And the affectation of diabetes, not only with the teeth, obviously, it damages our eye. So in some point they might not able to see perfectly. It affects the heart, it affects kidney and the liver as well. But in the dental area, the affectation is healing process is imperfect. Let's say, I don't want to use the word normal, but if a patient is non-diabetic, cut their hand, it heals in the normal way. 21 days later, there will be a scar top of it, depends on the area, but it heals. But with the diabetes patient, if it is not under control, the healing process, unfortunately, is imperfect.
For me to understand, because you said that the cells are not renew themselves, but what that means, let's say I have my teeth as I have, and I discovered I have a diabetes. What's happening actually in my mouth with the time, or what can happen with this?
Basically, the chemistry is like this. Normally, we need glucose for our cells to work, but the glucose level is dropping by, so there is not enough, let's say, fuel for the cells. That's why the cell do not have enough power, enough fuel to renew themselves. That's why the process is getting longer. That's the main issue with the bone, with the gum and the skin, or any cell in your body. Even if your oral hygiene is perfect, even if you take care perfect with anything in your body, if the glucose level is more or less in your body, the cells do not have enough fuel to renew themselves.
Okay, this I catch it, but when I have a diabetes, what's happening with my teeth, which is just happening or not happening with the patients without it, which is bringing me on your chair?
First thing is bone loss. Normally 90 days later, the bone cell will die and another bone cell will change with a new one. But after that cell is dead, if there is not enough bone cells, which are very small, that's why it is very insignificant, but from year to year it is getting significant. That's why patients say, 2 years later I didn't have any problem like this, but in 2 years it all started all over from the beginning. That's why in some age it is getting severe. That's when they feel the symptoms. because there is not enough bone around the teeth, there is not enough gum around the teeth. Because let's say you have 100 trillions of cells, but 90 days later, the bone cell numbers are getting dropped by. That means you're losing bone around your teeth.
So let's say there is not enough bone, okay? It start to, how to say that?
Movement of your teeth. Normally there will be always bacteria in our mouth. Whatever we do, we cannot prevent it. That bacteria also cause bone loss because mouth is not anything in the body. We talk about it again. Not like the hair, not like the eye, not like the nails or anything. The veins open directly inside the mouth. It bleeds insanely. Yeah, it bleeds too much. If there is too much bacteria, it's a reaction of the body.
Yeah.
If there are too much bacteria underneath the gum, that means the bacteria can able to spread around your body. It also another reason that the diabetes patients suffer from parodontosis. Usually I ask our patients if they suffer from parodontosis, do they have diabetes? If they are not, like 99%, some of their relatives have diabetes.
I got you. So we can like summarize somehow that having diabetes, it can bring the danger of the bone loss, and in the consequence, the teeth are not stable, they start to move, can be affected with the bacteria and cause the parodontosis as well.
Exactly.
So what would you would advise, for example, for the people starting to have the symptoms, starting to have maybe some issues with their teeth? What's the solution from your point of view?
The first thing is obviously definitely keep diabetes under control. Definitely see a physician to keep it under control. For the dental, after dental checkup, sometimes we only advise them to maintain oral hygiene. Sometimes just simple cleaning, sometimes if it is getting severe, deep cleaning. If we can able to stop it with deep cleaning, it will be stopped. But if the patient cannot maintain oral hygiene, it might go implantation or even full implantation.
Okay, I got you. So there is a hope at the end of the road.
Course,
there is a hope, and to say that very, very clearly, patients with diabetes, they can have the implants, right?
Of course, yeah, definitely, if it is under control. But sometimes it is not under control. In some cases, they have to be hospitalized. They have to taken care of in the hospital because the insulin level is dropped significantly, so they cannot get up. In those cases, definitely, first they have to take care of themselves because, again, it is not the first issue of the teeth. The eyes, the heart, the kidney, and the liver. They affect the most, then the dental.
I got you. So the patient has to be in a good shape. We can
Exactly. Then we will decide if whether they are okay for implantation or not.
Okay, that's good. So the patient with diabetes who probably can have the parodontosis, because of that, it's capable to have the some procedures to clean up the mouth and in the worst scenario to replace the teeth with the implants, and in the most worst scenario to put hopefully the dentures. Not, but you know, but it's a good thing. Like I have in my mind this picture of those portable dentures I was mentioned to you many times. That was a nightmare. If you have, you know, this all-on-4, all-on-6, I think it's, of course, it's not natural thing, but still you can adjust to that. So that's a good news from my point of view.
But in dental, they are very good, by the way. In dental, we make great job.
Yeah, I know. That's why we are here.